Morning, everyone. Welcome to the public session of today's Oversight and Engagement Board. I'll go straight to welcome everyone who's watching today. We are live on YouTube, and it will be available to watch back later should you wish to do so. So I'll come straight to the minutes for the previous meeting, which was held on the 4th of March. I presume everyone's happy with those. If not, please put your hand up. Looks as though everyone is, so we'll sign them off. Thank you very much. We'll come straight to Roslyn Harris for the COVID-19 weekly surveillance report. Good morning, Roslyn.
Morning, Councillor Morris, thank you. And you should see on your screen, the weekly surveillance report. I won't run over the first 7 slides because I think they've all not changed substantially since last week's councillor briefing, but also I think these are all messages that are familiar to everyone. So if I go straight to the data section, slide 8, you'll see for the week between the 1st and 7th of March, the number of cases in the county during that week was 548. This is the latest surveillance report because we don't have the full data for the subsequent weeks, the 8th to the 14th of March. But I can tell you, looking at the partial data that we do have for that week, it looks to be that cases have increased in the county from the week to the 7th compared to the week to the 14th of March. So that's not particularly good news, given that we've seen a sustained reduction in cases since Christmas time, and because of lockdown, I think that's really helped the cause, and particularly concerning given that restrictions haven't eased so far. So the data where we're seeing the increase in cases relates to exposure to the virus that happened before the schools reopening on the 8th of March. So nothing in terms of restrictions or regulations had changed during that period to account for an increase in cases, which should mean that we're looking at what's happening to create that increase in case rises. Part of that is likely to be the fact that in the weekend, the week from the 8th of March onwards, we have been testing more people. So we are testing people, testing all students in secondary schools and staff twice weekly now, which has accounted for sort of tens of thousands of more tests happening per week than it usually do. However, that's only finding quite a small number of positive cases, which we expect because it's asymptomatic testing. We're not expecting to find a lot of people who haven't got symptoms be positive. So it doesn't account for the increase that we're likely to see in next week's surveillance report. If we move on to the next slide showing case rates, so we can see that the Northamptonshire rate up to the 4th of March was around 72 per 100,000 cases per week. This was significantly higher than the England rate, and that's likely to remain the case in next week's surveillance report. So again, looking at the partial data that we have, it looks at that's probably going to increase and still be higher than the national average. And in terms of all of those district rates, we're looking to see all of those district rates bar the Northampton rate increase. Again, it's just partial data at the moment, so we haven't got absolutes on any of this, but I just wanted to note that because this report is likely to look at a lot more of a sort of rosier picture than we're expecting to see in tomorrow's updated surveillance report. If we move on to slide, apologies, 13, which should show cases by age and gender. So up until now, and it remains the case, the majority of positive cases are in the working age population. So people between the age of 20 and 60 make up the vast majority of cases. This is still the case, and cases in this group are increasing, but haven't increased over the last week to the degree that cases in the under 19s have increased. So as I say, because we're testing a lot more of that group, and because their case rates were pretty low to begin with, the relative increase in case in that group has been higher than for working age population. But the working age population is where we're seeing the majority of cases. In better news, we're not seeing countywide an increase in over 60s cases, which is really positive, because that we know that's the figure that's most likely to correlate to hospitalizations and deaths if we see an increase in the over 60s group. So we're hopeful that remains the case. If we move on to slide 15, which does show hospital beds occupied by confirmed COVID positive patients. So there are bumps in this trajectory, but generally the trajectory is downwards. We're hoping to see that continue. As I say, even if case rates rise, the idea is that given that the vaccine has, we've got really good coverage in county of those most vulnerable groups. So those are over 70 and clinically extremely vulnerable. The vast majority of those groups have been vaccinated now, and so the hope is that despite a rise in case rates, we won't see a corresponding rise in hospitalizations. But that's something that we're going to look at over the next 2 weeks, as we know that hospitalizations usually follow about a week or two behind changing case rates. Finally, I think if we move to the summary of outbreaks on slide 19, a slightly better picture in terms of outbreaks that are currently active. We're not seeing the sort of large outbreaks that we have seen in the past. So, for example, in Corby, despite having high case rates in Corby, the outbreaks that are currently being dealt with in Corby are relatively small. So that's again positive, but also pushing us to look at sort of household transmission and transmission in the community more than transmission in workplaces or settings, which in one way is positive. I think a lot of those settings have got a really good grip on how to prevent outbreaks at an early or even sort of stop them from developing at an early stage. But equally, it does give us some concern about what's happening in people's individual households and how we're controlling transmission between households. I think that's all I was going to pull out specifically from the surveillance pack, unless there are any questions from anyone. Happy to take
Thank you very much, Austin, for your update as always. I'm not seeing any question. Oh yes, there is one hand up. Chris Stanborough, good morning, sir. You're on mute.
Morning all. Yes, I'm a bit slow with my cursor. Thank you very much, Ian. Yeah, just a question really. It's about whether there's any additional advice to give families who have children, teenagers at home who have been asked to self-isolate because they've been back to school, a classmate's tested positive, and they've been told, okay, you've got to, your 12-year-old daughter now has to self-isolate for 14 days. If there's any extra advice they've given as to how to actually manage that within the home, because it's got to be so difficult. If you've got, for instance, if the child in question shares a bedroom with another child in the house and there are no extra bedrooms to move children into, if you've only got one bathroom in the house, presumably only one kitchen, what extra advice is available for families to manage that situation, please?
Thanks, Sandra. Yeah, that is a tricky one, particularly if space at a premium. I guess the main thing is to as much as possible reduce the time spent in rooms together. So if you do have to share a bedroom, to make sure that you're in separate rooms right up until you have to sleep in the same bedroom together. Similarly, shared bathrooms. We have got our comms team have done made some resources about this around timing of when you have your showers relative to the rest of the household. So if the rest of the household go before the person who's isolating, so they're the last in the day to use that shower facility. Similarly, not sharing, having separate towels, making sure that you clean down the bathroom after use. And the same thing with kitchens. If you could possibly, if the person that's not isolating prepares the meal, but then someone who is isolating could eat separately, if possible, at a different time. And again, that's in there's sort of a resource pack that the comms have developed around how to manage that in households. But yeah, I accept it is a tricky one, and it's just about doing as much as you can within that space. One thing I would say to parents who have children who are isolating as contacts, not as cases, is, and I think there is some confusion about this still, is that some parents believe that because they're only contacts and not cases, they don't necessarily have to stay at home. And it's especially confusing because the rest of the household can leave the home if it's just a contact they have in their household. And so we have heard some reports of parents letting those children go out and meet with or do sleepovers with other children or young people that are isolating as contacts. That is absolutely not what we want to see happening at all. If you are a contact, if you have been asked to isolate for 10 days as a contact, then you need to be staying in your household and not leaving the home. It's slightly different if you're if you've been asked to stay at home for a different reason. Maybe the school doesn't have enough teachers to support your learning in the classroom. Slightly different situation. But if you are classed as a close contact, you must stay at home.
Thank you very much for that question, Chris. A really good question, and thank you for the answer, Rosin. I suspect Kath will pick that up in her comms update as well shortly, but obviously the more information we get that we can pass out to our constituents, then the better that will be. So Kath will cover that in a minute. I'll bring back in Rosin now for a testing and contact tracing update. Rosin.
Thanks, Councillor Morris. So in terms of contact tracing, I think it remains good news. We're managing to reach 9 out of 10 of all cases and identify all the contacts for 9 out of 10 of cases that appear in the county. We can still do more. So as you'll see, that's the ranking in the East Midlands. So we were just behind Rutland in terms of our East Midlands colleagues, and Leicestershire have just pipped us to third place at the moment. We want to get as far over 90% as we can. So we're still looking at ways that we can reach more people. We know that there are certain people who are not going to engage and don't want to give their contact details to test and trace, and there's not much we can do about that. But sometimes it's just about reassuring people about where the data is going and how secure that information is, and that it's not going to be sort of handed out to just anyone. Sometimes just a reassuring call from our customer services team is all that's needed. So no huge changes in terms of contact tracing, just ploughing on and trying to find other methods to get people to engage with the test and trace process. So if we can move on to the testing slides, because there's a lot more to say on testing. And the first thing to say is if you've got symptoms, then please do go to either the County Council website or the .gov website, or just Google COVID test. It should get you to the .gov website booking system for people who have symptoms, where you can go on, book a testing slot at any one of our 11 test sites across the county. Most of those test sites are only now operating morning appointments, but you should be able to see what appointments are free by going online and booking a slot there. That's for people who have symptoms. There's a lot more testing available for people who don't have any symptoms. So I think most people will already be aware that testing is now available for in schools for students and staff in secondary schools, and staff only in primary schools. But there are more people outside of that cohort that are eligible for asymptomatic testing. So that's testing for people who don't have symptoms. If we move on to the next slide, sorry, Cheryl, that should show, yes. So the first way of getting tests if you don't have any symptoms is to come to one of our lateral flow or rapid test community sites. And we currently have 6 of these active across the county, in Corby, Northampton, in Brackley, Wellingborough and Daventry. And there are more to come online soon. So if you keep a watch out on the County Council website again, all the details of how you can book slots to come to our community testing sites is on there. Who's eligible for community testing at these sites? Well, currently anyone who's not able to work from home can come to our community testing sites. So that's quite a few people, we believe, probably in the tens of thousands across the county that are not already getting tested at their workplace. So obviously, if you're a teacher or an NHS worker or work in a care home, you will already be tested at your workplace. So please don't stop doing that to come to our community test sites. Continue with your workplace testing. But anyone outside of those groups who doesn't have workplace testing, this is for you if you're not able to work from home. So as I say, it's quite broad eligibility. If you are having to leave the house to work, please come and get up to twice weekly tests at any of those centres. We don't turn away anyone, but we are currently only open to 16 plus only. So this is not a children's testing facility. Any young people that are getting tested should be getting tested through their schools. So I think that's the main thing to say about our community testing sites. The other thing that's become available in recent weeks, and this is just targeted at the families of those returning to school or college and nurseries, actually. So any adult that's in a childcare support bubble or in the same household as any child or young person that's at nursery, at school, at college, can access home testing kits. So they can also access these community sites if they'd like to. So if you're in any of those categories, if you're in a bubble with a child at school, absolutely, please do feel free to book a slot at our community testing site. But the other option that's available to you is to collect home testing kits, which come in a pack of 7. So if you do them twice weekly, will last around 3 to 4 weeks. And you can collect so 2 boxes of 7 per person. So if you want to collect one for your partner or any other adult in your bubble, please feel free to do that. The places that you can collect these at the moment, if we skip back 2 slides, Cheryl, to go back to the symptomatic testing sites. So these are the sites, if you look at the 3rd column, Community Collect, all of those sites listed as yes to Community Collect, you will be able to go and collect in the afternoons between 1 PM and 7 PM your home testing kits if you're in a childcare bubble. An update since these slides were produced on Monday is that the Daventry site is now available and the East Northants site is now available, so that's in Thrapston. So both Daventry, Chaucerway and the Thrapston local testing site are all available alongside Corby, Northampton, Wellingborough, Kettering, are available to collect your home testing kits. As I say, that option, home testing kits, is currently only available to those who are in a childcare bubble. because we want to support the opening up of schools, and recognising that there are more children and young people mixing. The most likely area of transmission is actually adult to adult, and then to that child to go into school. So what we're trying to do is test the adults around the children that are returning to school. So I would encourage anyone who is in a childcare bubble to go ahead and pick up those home testing kits from any of those sites. There is a final option, and that is to go onto the .gov website for testing to order home delivery. But I do want to stress that the options for home delivery, this is really aimed at people who don't have any transport or can't access any of their local collect sites or one of their testing sites. So home delivery is an option, but it's pretty limited delivery slots available. And so I would just encourage people to leave those to people who really absolutely need them, who can't travel to collect sites. If you can, the option is definitely to go along to a collect site or go along to a local testing site. And I think that's all I have to say on the changes to testing. We're currently in the process of updating the County Council website to have more of this information available, as well as the information on workplace-based testing. So I haven't really touched upon that in the slide set, but if you are a private business, or if you fall under a number of categories in social care, so if you're a day centre or a domiciliary care provider or a care home, you can access workplace testing through a separate route. Again, all of that detail will be on our website shortly, and you should be getting that sort of information through, certainly if you're a social care provider, you'll be getting updates from our local social care team, and businesses should be getting that directly from BAYS, from central government, but also available on the website soon. And I think that's all from me. Thanks, Councillor Morris.
Thank you very much, Rossin. As always, a very thorough run through of the options, and testing and contact tracing is going to be vital over the coming months, particularly as we come out of lockdown and progress into the brave new world of non-lockdown. So it's encouraging to see the breadth that we're covering. There really is no escape from testing, in a sense. There are multiple options for people who require to be tested or need to be tested. So that's brilliant. Thank you very much. I'm looking for any questions. Can't see any. So I will come now to Kath Hall for her comms update. Good morning, Kath.
Morning. Just get all my notes. Yeah, so busy as always. So just wanted to cover briefly, obviously we continue to do quite a lot of work with Corby. We have done some work as well with Kettering to drop leaflets to targeted wards. Obviously Corby residents all had the household booklet. We've also recently recorded a radio advert with Joe Watt, who lives and works in Corby. So we feel like that's a good local voice to appeal to residents to take up their vaccine when they're called for it, and also to seek regular LFD testing if it's applicable to them. And we continue with social media and obviously the promotion of the lateral flows device testing sites, particularly in Corby. With testing in general, we've done press releases for all of the lateral flow device testing sites. We're doing social media to promote lateral flow device testing in general in working adults. And we've done a trial over the last week to do some paid for social media to promote the Corby sites, especially because there's 2 sites over there. That has so far reached over 70,000 people. So that's really, really good. We can tell there's been 85 unique link clicks. So that doesn't count people that repeatedly visit the site. So that's good because it goes straight through to the booking page, and we can see that people have taken action from seeing the advert and then clicked through to look at booking a test. Because that's gone well, we're going to look to do that across the other sites, Brackley, Wellingborough, Danescamp, Daventry, just to try and get numbers up, as Rossin said, there. lower in some of the more affluent areas, but if we target some of the wider sort of surrounding areas for those sites, hopefully we'll be able to get more uptake there. And again, as Rosin mentioned, we're going to start promoting the school bubble click and collect tests more widely. So quite a lot of work with testing. I expect that to continue for some time. Obviously, we've got the next step of the roadmap, what I'm calling 1B, coming up on 29th of March. So that's where people can meet outside in groups of 6 or 2 households together. We get the return of outdoor sport and the return of organised sports. So we're doing quite a lot in terms of prepping some assets for that, so people still are clear about what they can and cannot do. There's a lot of national narratives around holidays and all sorts of normal, if I can call it that, activity. So it's quite challenging locally to try and focus on what we can and cannot do, because we are still quite restricted and we need people to understand that. So a big focus on that. At the same time as prepping some assets around Easter, lots of mixing can take place over Easter. Depending on the weather as well, peaking, people can go out and mix quite a lot, country parks and outdoor spaces. Ramadan starts also on 12th of April for a month. So we're doing some preparation for that. And all at the same time, we split from 8 different councils into 2 new unitary councils. So there's quite a lot of work going on at the same time to rebrand everything. You know, it doesn't rain, but it pours. So there's quite a lot of work going on there. We're also about to launch a new campaign, which we're calling Take Care in the Open Air. So if you have some spare time and go and look at the government document, the roadmap out of lockdown, it has a piece about transmission outdoors. And whilst the risk is reduced outdoors, if you are within 2 meters of someone else, and especially when you're face to face with someone else, the risk of transmission is still high. So we're trying to make sure that people understand that and know what to do to take care outside. We're also doing some comms around how the virus can still transmit on surfaces outside, such as playgrounds, gates and railings. Just helping people to be prepared when they go into different places outside. They might have to queue. They might have to use contactless technology rather than cash, and to take hand sanitizer with them. People will also be allowed to mix in gardens. That's quite a difficult one because we can't go around putting banners up in everybody's gardens. So we're going to be doing some social media and some radio adverts around how to mix safely in private gardens. And then also, I'm sure you will have all seen, if you've been walking, you'll probably see discarded face masks lying across our pavements. So we're going to be doing a bit of a campaign to ask people to dispose of their masks safely in a bin. Not only is it a litter problem, but it can cause a public health risk. So we're just seeking a little bit more in terms of cost for that campaign, but hope to start planning that and getting that out in the next 7 to 10 days. Rosin's mentioned quite a lot on young people. So our gaming campaign continues. That's going across a number of platforms. There's a platform called Twitch. I think that's right. It's a gaming platform that a lot of young people are on. And then we've got adverts across Spotify, Deezer and Capital, just appealing to young people that COVID is not a game. Rosin mentioned as well, we've been working with an influencer. Her name is Tessa Bear on TikTok. She's got 6 million followers, just had a look. She's local to Northamptonshire, so that's really great. And she's done a couple of videos where she takes a lateral flow device test. And the 2 videos she's done have got over 700,000 views so far, which is, you know, brilliant. Obviously, some of those are wider than Northamptonshire, but we're getting the message out, and she's quite cool. So I'm sure lots of people will follow her and listen to her. She's done a very clear video. It's very good. And then our work with the BA, ME and underrepresented groups continues. So there's a whole different team working on this. They are looking at some pop-up sites for vaccinations, including some mosques. So I know Councillor HAC is quite involved in this as well, and a number of councillors really supportive of trying to help out in local communities. We're also really trying hard to work with the care home workers. We know that there's a lack of uptake among some of the care home workers, so we're trying to do more to help them with any hesitancy that they have. There's some national assets that we're sharing this week about people from the BAME communities who might have diabetes or sickle cell anemia, as those illnesses are more prevalent in the BAME communities. We're obviously working to prepare for Ramadan. Unfortunately, it's the second year running when Eid won't be able to take place in the normal way. So we'll be working with community leaders to try and make sure that we encourage people to celebrate safely in their homes or within the restrictions. There's a longer term piece of work going on around health inequalities. We think that vaccinations will become very much like flu, a regular thing year on year. That's a kind of prediction. So we're working to form a longer term plan around how we keep working with the BAME community. And we are doing some work with the Learning Disability Engagement Group just to make sure that our resources are accessible to people in the learning disability community. And the government helpfully are producing some easy read assets now, so that's helpful to share. Just relating to the education question about isolation, it's a good question. Self-isolation in the home with shared families. We do have a couple of documents that we've shared with, there's a school cell that send information out to head teachers and they then send it on to parents. Yeah, for every scenario, it's quite impossible to sort of guide if you've got shared bedrooms and things like that, or if indeed there's a child that's only 3 or 4 that might have COVID that, you know, can't be left on their own. So it's general guidance, and obviously where people can minimise risk as much as possible, that's what we would like. But we are working with schools on just developing more assets as and when situations come up that we can help more with. That's it from comms for now.
Thank you very much, Kath. As always, an awful lot going on in the comms department, and I think you're doing a really good job at reaching our community. So thank you for that. I'm looking around for any questions. I can't see any, in which case I will close the meeting shortly. Our next meeting date, in line with our new dates, is going to be the 1st of April at 8:30. I look forward to seeing you all there. In the meantime, have a good rest of week.